Diseases and injuries that damage the brain can impact how we interact with the world and lead to significant and disabling behavioral and psychological symptoms, also referred to as neuropsychiatric symptoms. When we think of Alzheimer's disease or related dementias, we typically think of memory loss or other cognitive abnormalities. But it's symptoms like agitation or psychosis that can cause the greatest challenges for the individual with dementia, their loved ones, and their caregivers. Similarly, when we think of a disease like Parkinson's disease, we typically think of muscle tremors and a shuffling walk, but we rarely hear about symptoms like depression or psychosis that are also caused by the neurological damage to the brain. These neuropsychiatric symptoms that lead to mood and emotional changes are the symptoms that almost no one talks about, but they are common in Alzheimer's disease and other dementias, Parkinson's disease, multiple sclerosis, and brain tumors, infections, and injuries. We rarely hear about neuropsychiatric symptoms because they are highly stigmatized and frequently dismissed as willful behavioral problems that caregivers need to deal with and worry about. The reality is that these symptoms require medical attention. They are as much a product of the disease or injury as changes to memory or motor skills. They occur as different parts of the brain are damaged by disease or injury. And because many of these diseases are progressive, neuropsychiatric symptoms can occur and worsen over time. Disease and damage to different parts of the brain cause different neuropsychiatric symptoms. Damage to the frontal lobe affects personality, behavior, social skills, motivation, and the ability to plan. It can give rise to apathy, the lack of emotion, disinhibition, and socially inappropriate behavior. The parietal lobe controls sensory and motor functions, spatial awareness, and the ability to write and do math. Damage to this part of the brain can cause difficulty finding one's way, dressing, and completing basic tasks. The temporal lobe controls speech and language, memory, processing what we hear, and our moods. Damage to the temporal lobe can cause depression, auditory hallucinations, and psychosis. The medial anterior temporal lobe plays a role in personality, decision-making, and emotional control. Damage to the amygdala in this part of the brain can lead to anger, aggression, agitation, anxiety, and fear. Damage to the hypothalamus can cause sleep issues and sundowning. And damage to the occipital lobe can give rise to visual hallucinations. As damage impacts multiple parts of the brain, it can lead to delirium, mood swings, distraction, disorientation, paranoia, and hallucinations. Neuropsychiatric symptoms can be severe and take an enormous physical, emotional, and financial toll. They can put the patient at risk of injury, alienate loved ones, and lead to the loss of critical social support, cause job loss, increase financial stress, limit the patient's ability to perform basic daily activities, lead to the need for earlier institutionalization, accelerate progression of their disease, and cause greater morbidity and accelerate mortality. Neuropsychiatric symptoms can also be a huge source of stress to caregivers, putting them in danger, causing them to miss work, adding to their expenses, taking an emotional toll, reducing their quality of life, raising their risk of death, and often making it so they can no longer handle their loved one's care and must turn to a long-term care facility for help. But placing these people in care centers is not always easy. They are often turned away because they are perceived as being too difficult and staff-intensive. Residents with neuropsychiatric symptoms raise the staff's risk of injury at work, increase their workloads, and cause burnout and high staff turnover. Despite their huge impact, neuropsychiatric symptoms are frequently misunderstood and misdiagnosed when there are ways to manage and treat them. Some symptoms can be reversed by finding and dealing with an environmental or medical cause. Others may respond to behavioral interventions, like avoiding confrontations, managing routines, providing reassurance, and creating calm environments. As symptoms progress, medications can help improve quality of life for the individual and their family caregivers. It's critical that we start talking about these symptoms with our loved ones, at medical visits, and with advocates. We need to shake the stigma and recognize neuropsychiatric symptoms as a medical condition that can be treated to lessen the burden of already devastating diseases.